Your body has its own early warning system. Long before a condition becomes severe, it sends out signals that something isn't right. Learning to listen is the first step toward taking control of your health. One of the most common signs is a change in urinary habits, a condition called polyuria. You might find yourself waking up multiple times a night, disrupting your sleep. During the day, the interruptions continue. You may feel a constant, pressing need to find a restroom, planning your day around bathroom availability. This is a significant shift from your normal routine. So, what's happening? When blood sugar is elevated, your kidneys work overtime. They can't reabsorb all the excess glucose, so they dump it into your urine. But glucose doesn't go alone, it pulls large amounts of water from your body along with it. This process, called osmotic diuresis, is what causes the frequent high-volume urination and is your body's attempt to restore balance. This fluid loss triggers another powerful signal, an intense, persistent thirst known as polydipsia. This isn't ordinary thirst, it's a deep, unquenchable craving for water that drinking doesn't satisfy for long. This creates a frustrating cycle. You drink to quench the thirst, which leads to more urination, which dehydrates you further, making you even thirstier. You're trapped in a loop: drink, urinate, repeat, with no lasting relief. This relentless cycle takes a toll. Constant sleep interruptions lead to daytime fatigue and brain fog. At work, the need for bathroom breaks and nagging thirst can shatter your concentration. Your social life can also be affected, causing anxiety about long car trips, sitting through a movie, or being anywhere without immediate access to a restroom. It can feel like your life is revolving around this cycle. If this sounds familiar, if you're constantly thirsty and always know where the nearest bathroom is, it's time to see your doctor. Don't dismiss these signs as a minor annoyance. A simple conversation and a quick blood test can provide the answers you need. Taking that step is crucial for your long-term well-being and can help you regain control of your life. The second major sign of diabetes is unexplained weight loss. While losing weight is often a goal, when it happens suddenly without changes to your diet or exercise, it's a serious red flag. This isn't weight loss to celebrate, it's a signal that your body is struggling to get the fuel it needs. To understand why, let's look at insulin. After you eat, your body turns food into glucose, a sugar that fuels your cells. Insulin acts like a key, unlocking your cells to let that glucose in. In a healthy body, this process is efficient, providing constant energy. With diabetes, this system fails. Your body either doesn't produce enough insulin, or your cells become resistant to it. The key is essentially broken or missing. As a result, glucose gets trapped in your bloodstream, unable to reach your starving cells. It's like having a full tank of gas but a clogged fuel line. The engine can't get power. In desperation, your body searches for other fuel sources. It turns on itself, breaking down fat stores and muscle tissue for energy. This is what causes the sudden, significant weight loss. You're not just losing fat, you're losing essential muscle mass, which is why this symptom is so concerning. This means you could be eating normally or even more than usual due to intense hunger, yet the number on the scale keeps dropping. We're talking about a noticeable loss, often 10 to 15 pounds over a few short months without any logical explanation. This symptom is often more dramatic and rapid in type 1 diabetes, where there's a complete lack of insulin. In type 2, the weight loss can be more gradual as the body still produces some insulin, but in either case, it's a critical warning that shouldn't be ignored. If this sounds familiar, it's time to see a doctor. A simple blood glucose test or a more comprehensive A1C test, which shows your average blood sugar over 3 months, can provide a clear diagnosis. Unexplained weight loss is your body sending a distress signal. Listening to it and getting checked early is the most important step for your long-term health. Feeling constantly hungry, even after big meals? This is called polyphagia. Glucose is in your blood but can't get into cells. Cells are starving and send "we're starving" signals to the brain. You might finish a meal and feel compelled to eat more. Eating spikes blood sugar, but without insulin action it stays high. Eat, spike, cells still starved, eat more. It becomes a vicious cycle. You can be thin, yet extremely hungry. A paradox of diabetes. If hunger is persistent and unexplained, get your blood sugar tested. Up next, your vision. Sign number 4 is blurry or fluctuating vision. This isn't the gradual, predictable vision decline that many people experience with age. Instead, it's a frustrating and often confusing instability where your eyesight can seem sharp one moment and hazy the next. You might find yourself questioning if you need new glasses only for your vision to clear up again a day or two later. This unpredictable nature is a key characteristic. This can manifest in many ways. You might be driving and find road signs difficult to decipher even though they were clear yesterday. Reading a book or scrolling on your phone might suddenly require you to squint, and focusing on your computer screen for work can become a significant strain, leading to headaches and eye fatigue. It can feel like your eyes just can't decide on the right prescription. So, what's happening inside your eye? The culprit is high blood sugar or hyperglycemia. Your eye's lens is a flexible structure that relies on a precise fluid balance to focus light correctly. When glucose levels in your blood are elevated, your body tries to dilute the sugar by pulling fluid from various tissues, including the lenses of your eyes. This influx of fluid causes the lens to swell and change shape. Because the lens has changed shape, it can no longer bend light accurately onto your retina, resulting in blurred vision. This effect is directly tied to your blood sugar levels. When your glucose is high, your vision may be blurry. As your levels come down, the lens returns to its normal shape, and your vision can sharpen again. This is the reason for the fluctuation. It's a direct reflection of the metabolic chaos happening in your body. It's crucial to distinguish this from presbyopia, the common age-related difficulty with near vision. While that condition is consistent and progressive, diabetic-related blurriness is erratic. If you find your vision swinging back and forth, it's a significant red flag that something more systemic is at play. Don't dismiss it as just getting older. An optometrist or ophthalmologist can be the first to suspect diabetes during a routine eye exam. While the lens swelling is temporary and often resolves with blood sugar control, persistently high glucose levels can cause permanent damage. Over time, it can harm the delicate blood vessels in the retina at the back of your eye. This condition is called diabetic retinopathy. It starts with tiny leaks and swelling and can progress to the growth of fragile abnormal blood vessels and scarring, which can lead to severe irreversible vision loss and even blindness. Therefore, if you notice your vision is unstable, don't wait. Schedule a comprehensive eye exam immediately, and be sure to mention the fluctuating nature of your symptoms to your eye doctor. They can check for signs of retinopathy, and will likely recommend you see your primary care physician for a blood sugar test. The good news is that when caught early, managing your blood sugar can not only restore your clear vision, but also dramatically reduce your risk of developing permanent eye damage. Taking action on this early warning sign is a critical step in protecting both your eyesight and your overall health. A cut that used to heal in days but now lingers for weeks is a warning. Minor sores that don't heal can deepen and become infected. High blood sugar damages blood vessels and reduces circulation to extremities. That means less oxygen and nutrients reach wounds, slowing healing. A small untreated sore can progress to a deep, dangerous ulcer. Neuropathy can hide pain. You might not notice until it's serious. Regular foot checks and prompt care prevent complications. See your clinician for any wound that won't heal. Daily care, proper shoes, and blood sugar control protect your feet. Frequent infections, urinary yeast or gum infections, can signal diabetes. Gum disease and slow response to antibiotics are red flags. High blood sugar weakens white blood cell function. Infections persist. Bacteria and yeast thrive in sugary environments. Women may have recurrent yeast infections. Both sexes can get frequent UTIs. If infections recur, test blood sugar as part of the workup. Treat infections promptly and check for underlying causes. There are resources and care teams to help. Repeated infections deserve evaluation. Start with a glucose test. Tingling, burning, or numbness in your feet and hands is a major sign. At first it's pins and needles. Later you may lose feeling. Chronically high sugar damages small blood vessels and nerves, starving them of nutrients. Signals get fuzzy and eventually stop. You may not notice small injuries that become serious ulcers. You might not feel heat or pain from everyday objects, increasing burn risk. See a clinician, control blood sugar, and perform daily foot checks. Early action reduces progression and preserves sensation. If you have numbness, schedule a checkup. Dark, velvety patches on the neck or armpit can signal insulin resistance. Often mistaken for dirt or poor hygiene, but it's medical. High insulin levels cause skin cells to reproduce rapidly and darken. In children and teens, it can be the first visible clue of prediabetes. Don't dismiss it. Consult a pediatrician or family doctor. It's a chance for early intervention with diet and exercise. Address insulin resistance, and the patches can improve. Early steps can protect long-term metabolic health. Small changes can make a big difference. Feeling tired all the time, beyond normal stress, can be a diabetes sign, often dismissed as busy life, but persistent low energy is worth noting. When glucose can't enter cells, your body lacks usable energy. You may feel weak, fatigued, and less able to exercise. Fatigue often appears alongside thirst, weight changes, or hunger. Track patterns. Fatigue that coincides with other signs is meaningful. A simple blood test can determine if blood sugar is the cause. If diagnosed, small lifestyle changes can restore energy. Listen to your body. Energy matters. We've covered many visible signs. If you notice several, act. Don't wait for symptoms to worsen. Schedule a check. A fasting glucose, A1C, or oral glucose tolerance test gives a clear picture. Diagnosis is not a sentence. It's an opportunity to manage your health. Doctors, nurses, dietitians, and educators will help build a plan. Focus on healthy eating, regular activity, and medication if needed. You are not alone. Join support networks and access resources. Track progress and celebrate small wins. Listen to your body, get tested, and take control.